Hey there everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. We like to see our patients at age 7 or 8 because there are some indications for early treatment or phase 1 treatment, and it's really important to evaluate kids early when they're 7 or 8 years old when there's still lots of growth remaining. So there are a couple of reasons why we'd get involved in an 8 or 9-year-old's mouth. One would be excessive crowding. Another would be if there is something that's preventing the jaws from growing normally. And another indication would be to try to make sure that all the permanent teeth can come into the mouth safely. So here's an example of 2 of those 3 things, and I'm going to show you a little bit about Bryce. And before I talk to you about Bryce, I want you to try something if you're listening to this. All right, I want you to swallow. All right, and as you swallow, I want you to mentally take a note of where your tongue goes when you swallow. All right, so go ahead and take another swallow and take notice of where your tongue goes. For most of us, your tongue is going to go up to the roof of your mouth. And that's the correct position for the tongue when you swallow. But for some people, like Bryce here, when he swallows, the tongue comes forward. And the reason the tongue comes forward is because he has a space between his upper and lower front teeth. You can see that in this picture of him right here. And to create a seal, he has to put his tongue up in between those teeth to create the seal to then be able to push the food down and swallow. And so, unfortunately, some people don't, as the tongue comes forward, it prevents the teeth from coming together, and the teeth don't come together, and so then the tongue continues to come forward, and you continue to have the tongue going to the wrong place and incorrect swallowing patterns. So it's really a cycle, and it's kind of a chicken or the egg problem, really. But in these cases, when the tongue is coming forward and sitting in a forward position and not going up to the roof of the mouth, the tongue actually plays a role in the development of the upper jaw. And the tongue really should sit up towards the roof of the mouth, and it's helping to develop the upper jaw or the palate. So in some cases, we have abnormal development of the upper jaw because of the tongue being in the wrong place. I'll show you this in just a second. Here's a close-up of Bryce's teeth, and you'll again notice that the upper and the lower front teeth don't touch. We call this an anterior open bite. Anterior open bites are something that I'm well familiar with. I had an anterior open bite as a kid, and when you have an anterior open bite, you bite into a piece of pizza, and it's hard to get the cheese and the pepperoni to come with it because your teeth don't come together. You have to kind of bite it from the side. Or you bite into a sandwich and the piece of lettuce or the tomato doesn't quite come with it either, because again, you can't make your front teeth meet. You kind of have to bite it with the side of your mouth. So in young kids, this can be an issue for tongue position. And Bryce had one other, and by the way, when the tongue is not up in the roof of the mouth, the upper jaw is not developing laterally in a side-to-side way as big as it could be. So Bryce has kind of a small upper jaw, and it's a little hard to see that, but if you look at these teeth right here, these are the upper and lower canine teeth. Right here, the upper and lower canine teeth. You'll notice that the upper canine teeth are actually a little bit to the inside of the lower canine teeth, and they really belong to the outside. Let me show you one other thing about Bryce. So these are his upper teeth, and you'll notice that right here we have our upper lateral incisor trying to find its way into the mouth, and over here we have the other upper lateral incisor trying to find its way into the mouth. But both of them are lacking space, and they're lacking space because the upper jaw has not fully developed in that side-to-side way. Again, that's a result of the tongue not going up and pressing into that into the roof of the mouth. And so we have a narrow upper jaw. We have crowding, these 2 teeth can't come into where they belong, and we have the low tongue posture affecting the growth of the jaws. So what do we do for Bryce? We started with a palate expander, something to actually make the upper jaw bigger. I don't have a picture of that in his mouth. And then we added a few braces onto the front teeth. So the front 6 teeth got braces. Here's where we finished with Bryce. This, by the way, all happened within 1 year. And so you might be able to notice that there's a wider upper jaw here. I actually bonded a little wire on the back side of these 2 front teeth because there's a gap between the 2 front teeth when we started, and we wanted to make sure that that gap didn't come back. But you'll notice that we opened up space and we got these lateral incisors into the mouth safely. Now we actually have a little bit of extra space here, a little bit of spacing, which is fantastic. You'll notice when I show you this point of view that the canine teeth are now to the upper canine teeth are to the outside of the lower canine teeth, which is the proper bite relationship. So the palate expander widened the upper jaw artificially, but that also now gives more space for the tongue to go up into the roof of his mouth and help that development continue. The braces were able to bring those two lateral incisors, this tooth and this tooth, into the mouth, and braces were also able to take these front teeth and bring them down so that they overlap these lower front teeth. So Bryce can now successfully bite into a piece of pizza and get the cheese and the pepperoni. He can bite into those sandwiches and get the lettuce and the tomato. And we didn't get involved for this reason, but he's also got a much nicer smile here at the end of treatment as well. So the added smile is just icing on the cake. We really did this to help correct the growth of the upper jaw. So we've got upper jaw growth happening more normally now. We've created space for the tongue to go up into the roof of the mouth. Hopefully we've stopped the what we call a tongue thrust, or the tongue coming forward in between the upper and lower front teeth. And we've made space for all the upper front teeth, or all the upper teeth, to come into the arch. So this is a really successful phase 1 treatment. At this point, we will monitor Bryce. We will watch him about every 6 months, and we'll be watching to make sure that the baby teeth are lost correctly, that the adult teeth come in correctly, and if he needs orthodontic treatment in the future, probably will wait until he has all of his permanent teeth. So that's a few years away into the future. But that's why this is a great intervention when he's young. Bryce is currently 9 years old. We started him when he was 8 years old. And like I said, we finished all this within about a year. So really successful phase 1 treatment. Hopefully you guys learned something about that, and would love to check out your 7 or 8 year old and to evaluate if there's a need for early treatment. Most kids will not require early treatment, but this is a great example of really successful phase 1 treatment. Thanks for listening.